In the middle of a mental health crisis, there is a big change in how people are getting help in Colorado. This more than a month now after an Arizona company took over answering crisis calls. I talked with behavioral health specialists who say they are still worried at this point. Rocky Mountain Crisis Partners had been responsible for answering both 988 and Colorado Crisis Services calls and texts. But then they lost that bid for the very first time earlier this year. I looked into that change, found that the state chose to give that work to a company that's never actually worked in Colorado before, called Solari out of Arizona. One of the co-founders for the Crisis Partner said that she was finally able to sit down and talk about why she is so worried about outsourcing this kind of help in the middle of an epidemic.
Colorado has disrupted a level of service. Colorado has took an investment of 14 years and tossed it all aside to invest in a company that's never been in our state. How do you perform here? How do you learn the system? How do you understand what's important to the communities? You know, Colorado is a very diverse state. We have metro areas, and we have rural areas, and we have frontier areas.
Now, I did reach out to the state. They said that they picked Solari because it received the highest score in an evaluation process. Their bids, however, also came in slightly lower than Rocky Mountain Crisis Partners. And not everything was outsourced. The CEO for Solari said that only Coloradans or people who already have a history of working in the state are answering calls for help. I also learned the executive leadership is routinely working out of Colorado as well.
It's going to take time, and we're dedicated to putting in the effort. And so we have a lot of trust to build here in the community, being an outsider. And so we're dedicated to doing that and making sure that that we're meeting the needs and the unique needs of Coloradans.
So with all of this said and done, and this is so important, you need to know that someone is still answering 988 and Colorado Crisis Services. That help is still available 24/7. You should absolutely be reaching out if you need help at any point, night or day.
Yeah. But we always hear, Anusha, that there is a workforce shortage for behavioral health workers. How is that affecting this?
Yeah, I mean, and I think that's the part that is actually really worrisome to some behavioral health specialists, because, you know, Sherry, who you just heard from, said that some people were opting out of the industry because of the politics. And then not all of the positions aligned with the new company as well. So it went from around 300 people working with Rocky Mountain Crisis Partners down to 180 with Solari, but they were saying that all of them are full-time versus a mix with part-time. But that is definitely one of the concerns and one of the issues, right? Because we're still in the middle of such an intense crisis.
Yeah, absolutely. Very important information. Good to know, though.